I was informed that I would be losing my insurance.
Thursday night was an emotional night in the church's fellowship hall. People from all over gathered for a town hall meeting with local politicians about the rising cost of health care. 57-year-old Connie Rathers from Appleton was in attendance and shared her story.
And on January 5th, I walked into work and was told with really no preparation ahead of time that my position had been eliminated.
And with that, she would no longer receive health insurance. So she had some options: either pony up the $574 a month premium to buy her old insurance under the federally mandated COBRA plan, or look for her own. She's opted to do both. However, having already been diagnosed with arthritis and high cholesterol, she's finding it very difficult to get approved for a new plan. She says she was approved by one company, but it came with restrictions.
They would cover nothing related to my toe or foot for a year because I have injury-related arthritis in my right big toe. And they would never cover anything related to arthritis of any kind or degenerative joint disease for the rest of my life.
And that is that no citizen.
Congressman Steve Kagan is a Democrat and in his second term, and he says he ran for office because he wanted to fix a broken healthcare system. A doctor of 30 years, he says it's critical to make healthcare more affordable.
People are losing their jobs. With that, they lose their hope and their security. They're losing their health insurance coverage.
Now, with the country focusing on the bad economy and the Democrats and Republicans still yelling at each other, is it even realistic to think that healthcare reform will get done in the near future? Kagan says yes.
Oh, it's very realistic. It's an absolute medical and economic necessity. More and more people are going bankrupt, not because they can't pay their mortgage, but because they can't pay their health care bills.
Now, Kagan says he hopes by having these types of discussions he can bring stories like Connie's and others to the forefront. But it won't be an easy task, considering the country is already expected to be facing more than a $1.5 trillion deficit, and a major overhaul to the healthcare system would likely push that even higher. For First News, I'm Ted Johnsen.